Hey, we are talking kids with Dr. Caitlynn this morning with Lexington pediatrician Dr. Caitlynn Edding. Good to see you.
Yeah, good morning.
So the topic today, congenital heart disease.
Yes.
And thanks to technology, we're in a much better place than we were even just 20 years ago. I
Yeah,
understand.
absolutely. So we just wrapped up Congenital Heart Disease Week. That was the 7th through the 14th. And it is the most common birth defect in children. So 1 in 100 kids will have some sort of structural abnormality with their heart, and about 1 out of 4 of those will have what we call a critical lesion, right?
Critical.
And so critical means that they will have to have some sort of surgical intervention. Some of these kids, multiple surgical interventions within the first year of life, okay? And over the past, 20 to 30 years, there have been lots of different advances in surgery and technology, earlier detection that are really starting to make it so that these kids can survive and then thrive.
Yes.
And so there are about 2.6 million people in the United States living with congenital heart disease
Oh, wow.
as of today. So
That's a big
yeah.
number.
Yeah.
So thanks to technology, parents, you're not going to be able to minimize the impact, I'm sure, or the fright factor when they get that diagnosis.
Correct.
But thanks to tech and thanks to our advances, we're on a better path.
Yeah, and with kids living longer now, it does kind of put more strain on parents and even the kids, as far as a lot of these kids will have developmental delays. They'll have learning problems when they start school, just because early on it's a struggle to kind of get that nutrition in. And so it's great that we now also have all these different foundations that are really good support systems for these parents, for these kids, that kind of help them all the way from birth all the way through adulthood, just to get plugged in, make sure they have those resources. And February is always a good time of year, if you're like, I'm not into Valentine's Day, to just think about like donating to one of these heart programs.
Perfect.
Yeah.
Perfect. So what's your best advice for parents then when they are on the right side of this and they need to start blazing that trail forward to make things as easy as they can for children that are moving past?
Yeah, so if you have your own child that has congenital heart, like I said, getting plugged in with these organizations. But if you don't, just making sure that if you 1 in 100, you'll know someone that has a kid. My eldest daughter actually has a congenital heart defect, and she luckily didn't have to have surgery. But making sure that you are donating, you're giving, you're doing these heart walks, you're kind of supporting these kids and these families through this.
Takes a village.
Yeah.
Dr. Caitlynn, we appreciate you. Back with more after this.